Before each injection, make sure to read the medication guide provided by your healthcare professional. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using Xiaflex Vial to treat Dupuytren's contracture, your healthcare provider will inject the medication into the affected hand. After the injection, your hand will be wrapped in soft gauze, and you should limit hand movement and keep the hand elevated until bedtime. Avoid trying to straighten, curl, or move the injected finger until your doctor gives the okay. Notify your doctor immediately if you start to feel numbness, tingling, or pins and needles in your hand during the procedure. You'll need to return to your doctor's office within 1 to 3 days after the procedure. Your doctor will check your hand, try to straighten the finger if needed, and apply a splint. You should wear the splint every night at bedtime as directed by your doctor, for up to 4 months, and do finger exercises several times a day. Avoid any strenuous activity with the treated hand until your doctor gives the green light. Inform your doctor if you have trouble bending the finger after the swelling goes down or problems using your hand. For treating Peyronie's disease with Xiaflex Vial, your healthcare provider will inject the medication into the plaque in the penis. Each treatment cycle consists of 2 injections 1 to 3 days apart and a modeling, straightening, procedure 1 to 3 days after the second injection. Refrain from sexual activity between the first and second injections of a treatment cycle and for at least 4 weeks after the second injection. Only resume sexual activity when your doctor says it's safe to do so, usually after all the pain and swelling have subsided. You might have as many as 4 treatment cycles, each about 6 weeks apart. Follow your doctor's instructions on straightening and stretching the penis in between cycles, and notify your doctor if you have trouble stretching or straightening your penis or if new pain occurs. Some common side effects of Xiaflex Vial include pain, swelling, bruising, bleeding, redness, and itching at the injection site. You may also experience swollen, painful areas in the elbow and underarm if the medication is injected in the hand. If any of these effects persist or worsen, it's important to inform your doctor. Additionally, if you feel dizzy or faint, it's essential to let your doctor know right away. It's important to note that the benefits of this medication outweigh the risk of side effects for most people. However, it's crucial to report any serious side effects, such as signs of infection, nerve injury, tears in the skin, or difficulty moving your fingers or hand. In some cases, people using Xiaflex Vial for Peyronie's disease have experienced lower back pain after receiving an injection. If you experience sudden lower back pain or back pain that spreads to your legs, feet, arms, or chest, it's important to seek medical attention. While rare, a serious allergic reaction to this medication is possible. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical help. It's important to report any other effects not listed to your doctor or pharmacist. Remember, this is not a complete list of possible side effects, and it's important to consult your doctor for any concerns. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Xiaflex Vial, make sure to let your doctor know if you are allergic to collagenase or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. It's also important to inform your doctor about your medical history, especially if you have any bleeding or clotting problems. If you are using this medication to treat Peyronie's disease, it's recommended to avoid using a vacuum erection device during your treatment and to avoid straining your stomach or abdominal muscles. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication. And if you are breastfeeding, consult your doctor before using Xiaflex Vial. It's important to be aware of any potential drug interactions with Xiaflex Vial, as they may change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xiaflex Vial include drugs that can cause bleeding or bruising, such as aspirin, antiplatelet drugs like clopidogrel, NSAIDs like ibuprofen, and blood thinners such as warfarin. Your doctor may advise you to stop taking these medications 7 days before your injection. If so, ask your doctor when it is safe to start taking them again. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, usually 81 to 162 mg a day, you should continue taking the aspirin unless your doctor instructs you otherwise. It's important to consult your doctor or pharmacist about using these products safely. Xiaflex Vial is used to treat a condition called Dupuytren's contracture in adults. It is also used to treat Peyronie's disease in men. Xiaflex Vial is given as an injection directly into the affected area by a healthcare professional. The number of injections will depend on your condition and the response to treatment. Each injection is given at least 1 month apart. The timing of the injections will be determined by your healthcare professional. Make sure to attend all of your medical and laboratory appointments as scheduled. This is important for monitoring your progress and ensuring that Xiaflex Vial is working effectively for you. It also allows your healthcare provider to make any necessary adjustments to your treatment plan. Make sure to take each dose of Xiaflex Vial as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor immediately to determine a new dosing schedule. When it comes to Xiaflex Vial, it is important to note that this medication is typically administered in a medical setting, such as a doctor's office, and is not meant to be stored or used at home. This medication is used to treat a condition called Dupuytren's contracture, which is a hand deformity that causes the fingers to bend towards the palm and makes it difficult to straighten them. Your doctor will determine the appropriate dosage and timing for your specific condition, so it's important to follow their instructions closely. Remember to discuss any concerns or questions about this medication with your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.